Assalamu alaikum. This is Dr. Ingrid Madsen. I am the London and Windsor Community Chair in Islamic Studies at Huron University College in London, Canada. And I am back for part 2 of my conversation with Dr. Nour Akhras, who is the head of Pediatric Infectious Diseases at AMITA Women and Children's Hospital in Illinois, and with Dr. Wael Haddara, who is Chief of Critical Care at London Health Sciences Centre and Chair of the Division of Critical Care Medicine in London, Ontario. Assalamu alaikum. Dr. Nour, we're at the start of the school year. Some children are already returning to school in parts of the United States, and in Canada will be going back to school soon. What's the best thing that we can do for children to keep them safe?
So the best thing is, if they're vaccine eligible, to vaccinate them. And for those who are not vaccine eligible, to surround them with people who have been vaccinated, meaning all the teachers, all of the staff, and then to keep them masked. Everybody's masked, to keep the buildings well ventilated, to keep increasing or encouraging hand washing, and to really be vigilant about contact tracing, about being transparent, having the school being completely transparent about any exposures in the school, and preventing more exposure by keeping that child at home if they're tested positive or if they're sick. So last year's policy with masking and distancing and ventilating and quarantining really was very effective, and not even just in preventing COVID, but in preventing a lot of other infections. So for example, I usually see at least 3 or 4 cases of very complicated pneumonias with empyemas, which is like fluid around the lungs that get infected. I usually see 3 or 4 cases a year. I didn't see any cases last year, 0. Same with influenza. I see severe influenza with bacterial superinfections. I see like maybe 5 or 6 cases a year. Last year I saw 0. So masks work. And there's actually a study that just came out of North Carolina about a couple of days ago, where they studied 1 million children. And looking at North Carolina had a really robust data collection system in the schools, where all the data had to be presented about who got infected and who didn't. And they followed 1 million people. They had about 7,000 cases of COVID in the schools. 40,000 people had to quarantine. And out of those 7,000 cases, they only had 300 secondary infections, where if you think about the Alpha variant, for every person that got infected, we know that they infected like 2 to 5 other people. But with masks, that didn't happen. And so masks work, even though it's become a politicized thing. It's not really politicized. I mean, for people in medicine, people know that before COVID, when I would go to the hospital and I had patients in isolation for RSV or other viral illnesses, I had to wear a mask. That was the policy of the hospital. So that when I went in there, I would not contract any of the respiratory viruses they got, and I would not transmit it to other patients. So I'd come out, I would take off my mask, gowns and gloves, and wash my hands and go to the next patient room. So, and then for people who say that, oh, masks have adverse events, well, talk to a surgeon who's in a mask 12 hours a day, a transplant surgeon, or their neurons are all functioning very well, I would say. They continue to think well, they continue to function well outside of the hospital. So these are the most effective strategies: vaccinating, ventilating, distancing, masking, and good contact tracing with quarantine if somebody is positive.
Great, thank you. Dr. Haddara, what about the Delta variant now for children? Are children at increased risk with the Delta variant circulating?
Yeah, so the data is still coming in on this. There is a possibility, there are some papers that have not been peer reviewed yet, but they have been published online suggesting that the Delta variant is more dangerous in terms of it resulting in more hospitalizations in kids, up to 2.5 times the original or the Alpha variant. Not even the original, but certainly without a doubt, it is more infectious. And so again, as we increase opening up of society with the schools coming back and with the fact that you cannot vaccinate at this point in time anyway, children under 12, the increased volume, the increased infectiousness, even in the absence of increased risk of hospitalization, will result in more kids in hospitals. We've done an analysis here for just the City of London, Ontario, and the surrounding area. It's a very small population area with maybe 500,000 people. And our prediction is that without any mitigating interventions, we may end up seeing something like 1 to 3 admissions into the ICU on a weekly basis into our hospitals. And eventually there will be some deaths. And I think people probably don't really truly understand the emotional impact of a pediatric death. It's a very, very different, I mean, Dr. Akhras obviously knows much more about this than I do, but it's a very, very different impact on a community from an adult death.
Dr. Akhras, can you talk a little bit about your experience dealing with children in this COVID epidemic? And I know that in the state of Illinois, where you are, and the greater Chicago area, that there has been a pretty good uptake of vaccines and public health measures. I know that's not the same in every state in the United States. Can you talk a little bit about how you see the risk to children? What are the benefits of vaccines for those who are eligible? And what's happening in jurisdictions where there isn't a high uptake in vaccine and these public health measures?
Yeah, so I'm on a lot of COVID Facebook physician groups, so I read a lot about like what my colleagues are seeing. And in the southern part of the United States, where vaccine uptake is not very high, there are places that do not have any more pediatric ICU beds because they're just filled with either COVID, or now that restrictions have been lifted, we're seeing a lot of RSV, which is normally a winter respiratory virus, but it's come back with a vengeance because we didn't see it all last winter. So now that the children are getting together unmasked, there's a lot of RSV, and so those kids are ending up in the ICU too. So the other day I actually read a case about a child who had to be transported across 2 state lines to find an ICU bed, which is unheard of, and that's crazy. And then in states in the South where the schools have opened with no mask mandate, a week in, they had to shut it down because they had so much COVID. And so, like Dr. Haddara said, like when we have a COVID death in a child, that it's really impactful on all of us. This is why I love pediatrics, because mostly children are very resilient. They get well very quickly, even if they have bad disease. But when you think about COVID and how preventable it is, especially with the vaccines and keeping, like if your family is vaccinated and you're trying to protect your children, and then your child ends up with COVID and ends up in the ICU, that it's really scary. And especially as a parent, like I remember we had one of the first cases in the United States of multi-system inflammatory syndrome in children. This is a post-COVID inflammatory process where the children are coming in with, they can't keep their blood pressure up, basically. They go into hypotension and their heart stops pumping well. And we didn't know what that was. It was very early on. It was like March or April of last year. And just to see that child with so many catheters and tubes and IVs and intubated, like you never want to see your child like that. You never want to see a child like that, but especially your own child. Like that's a very difficult place to be. So I just think, again, like to surround your child, to protect your child with vaccinated people, just to keep the layers of mitigation to be able to protect your child as much as you can, and protecting yourself from that psychological impact of having to watch your child in the ICU intubated, not knowing if they're going to come off the vent, or not knowing if their heart is going to start pumping again at a full level. I think the vaccine, even taking the vaccine just to prevent that, is worth it.
All right, thank you. Dr. Haddara, as well as being a physician, chief of critical care, you're also a member, an active member of the Muslim community, and your family participates in community events and attends institutions. How should the Muslim community be looking at dealing with keeping our community safe at this stage in the pandemic, whether it is the full-time Islamic schools, the weekend schools, going to the masjid to pray? What's your view on this?
So I think everything that Dr. Akhras has said about the school setting applies to our communities. We have a wide range of people that come to that participate in the community, from people who are elderly and are immunocompromised to young kids. And so we have the entire spectrum of vulnerability in our community. The nature of our communities being very warm and very physical, but also the nature of things like the prayer and the space that is available does not lend itself well to things like physical distancing. And so masking, hand hygiene, trying to reduce physical distancing where possible, but also then vaccinations become very important. Now, I have a specific bias, which is that I do think that we should be looking at vaccine mandates for community events. If you are able to be vaccinated but are unwilling to be vaccinated, then I think you should also acknowledge that participating in community activities is a privilege and not a right. And it really, the situation reminds me of the hadith of the Prophet ﷺ about, people who are together on a ship. So they draw lots, and some of them end up on the bottom and some end up on the top. And the people on the bottom want to poke a hole in the hull to get access to water, so that they don't disturb the people above them. And as the Prophet ﷺ says, if they let them, then they all die. They will all perish. So there is what an individual can do is very different from what a community can do. So an individual can choose to not be vaccinated, that's fine. But a community at this stage probably cannot afford to have an uncritical approach to vaccinations. Again, it's important to acknowledge that there are some people who want to be vaccinated, who don't have a problem with vaccinations, but have very practical barriers around their difficult work or being able to take time off in the event of, being knocked out by the vaccine for a day, as some people have been. And so we should be respectful of those issues and try and find solutions for vaccine accessibility. But for the people that don't want to be vaccinated, they should also be respectful of other people's risk and avoid that kind of community contact.
What's your view, Dr. Akhras?
Yeah, I totally agree. And I actually will take it a step further and say that people who refuse to vaccinate, not for reasons that they can't, they just refuse to, but they're taking hospital space, they're taking ER beds, and they're making the person who did vaccinate and had a heart attack, or who did vaccinate and was in a car accident or in a trauma, they're delaying care for those people. And ethically, that doesn't seem right to me. We really need to think about things like that. Like, that needs to be a conversation, especially now in the south of the United States, where, like I said, not even just the pediatric beds are filled up, but the ICU beds, there are so many hospitals saying we have no more space, we have no beds, there are no beds here, we don't, and to think about somebody who, decided not to vaccinate, then got COVID, then got severe COVID, and is now, replacing the space of a person who did everything that they could to prevent themselves from getting ill, but then had some other, reason to be in the hospital. Where's the ethics of that? Yeah, I think we need to think about that.
Yeah, a lot to think about. And finally, I just wanted to ask each of you, maybe Dr. Akhras, you can begin, and then Dr. Haddara, just to finish up by speaking to the sense of anxiety that we have, the mental health concerns we have about, for ourselves dealing with anxiety, about the situation, the constantly changing and uncertain situation, as well as with our children. So what do we need to do first to support our kids, and then in general for all of us to keep maintaining a sense of, hope, optimism, realism, but to face what we're facing these days?
Well, I think one of the benefits of COVID for me had been like, I've been outside a lot more than I ever have in my whole life. So I've taken a lot more walks with and without my children. And that's been really helpful for me just to get some peace and quiet, maybe staying off of social media for a little bit, and staying away from the news cycle, because it seems like every 5 seconds there's something new, and that does trigger trauma or anxiety. Ultimately, I think it's really important to just have tawakkul on Allah subhanahu wa ta'ala, and know that you're doing everything that you can to try to protect yourself and your family, and that's all anybody can ask of you. Even that's all Allah subhanahu wa ta'ala can ask of you. So just having that reliance on Allah subhanahu wa ta'ala, that look, I did everything that I could, and now it's, I'm going to leave it up to you, Ya Allah, and just please protect my family and make dua. And I think just kids see the adults in their lives and see how they handle stress and how they handle anxiety. And I think more importantly than talking to them about it is demonstrating how you handle the stress of it, by saying, okay, Mama needs a timeout, like I'm very stressed, I'm going for a walk, or Mama needs a timeout, I'm gonna go pray 2 rak'ahs, I'll be right back. And just showing them ways to deal with stress and anxiety in healthy ways, in positive ways, in ways that you're mindful of Allah subhanahu wa ta'ala, and how ultimately He's in control of everything. So those are the strategies I've used, and they've been pretty helpful. And we're not getting out of this pandemic, and I predicted 2 to 4 years before it started, 2 to 4 years. So we're at the almost 1.5 year mark. And just knowing also that pandemics have hit humanity before. This is not the first one. This one won't be the last one. And people have survived, and they've become more resilient in some ways. And ultimately just tawakkul. I think that would be the last thing I would leave it at.
Thank you so much. Dr. Haddara?
I don't have nearly anything as intelligent to say. I think it's just important to acknowledge that it is stressful, and that if people do find themselves feeling gloomy, particularly as Dr. Akhras said with the news cycle, that it's important to acknowledge that that's perfectly normal. And I, for self-disclosure, I've gone through periods in the last 1.5 years when I was on the verge of, breaking, which has, is a very new experience for me. But it is a stressful situation. I think, maybe I can offer 2 suggestions, and they're both about things not to do rather than to do. The first is not to compare ourselves to other people. What I've heard some people say is, yes, but look at Gaza, or look at Afghanistan, or, look at Bangladesh. of course, people have been suffering for a long time in many other places around the world, but that's not our reality, and it's not helpful to remind people when they are stressed that there are people that are doing worse. Your headache is your headache, and you have to deal with it. And so the fact that there are other people in the world that are worse off is not a helpful comparator. Similarly, the time we all have a little bit more time, I think, than usual. And for many of us, we spend that time on social media, and that's probably the worst place where you could be right now, because some people anyway, are posting their vacation pictures and their, the millionth, vintage table that they built in their garage, or the amazing cake decoration skills that they picked up. And that's not everybody. I think most of us are just squeaking by, trying to stay sane, looking after our kids and going to work and making sure people are not dying. And so again, this sense of being on social media can leave you with a sense of being distinctly unaccomplished. That was the case before COVID. I'm seeing it now in spades. So don't compare yourself to people that are worse off. Don't compare yourself to people that seem to be, thriving. And the last thing I'd say is stop trying to get to the other end of this. I think people are putting off a lot of stuff until things are better. Of course, some things can only be done post-COVID, but I think, as Dr. Akhras said, this may be here for at least for an indeterminate period of time. Maybe over by next year, may not be. And until the rest of the world is vaccinated, it's less likely that it will be over quickly. And so stop trying to think about when this is over, I will do X, and we should start kind of realigning our lives to what we can do in the moment and for the time being.
Really good advice. Thank you so much, subhanAllah. Well, I want to thank both of you, Dr. Haddara and Dr. Akhras, for sharing your expertise and your wisdom with us today. May Allah bless you and protect you and reward you for all that you're doing to keep all of us safe. Thank you. Assalamu alaikum.
Alaikum salam.